Welcome back to Life Begins at 50. I'm your host, Carol Lee Espy. Now, unfortunately, around 50, our eyesight is not quite what it used to be. In addition, it's a time when many of us begin to experience cataracts. Fortunately, we don't have to suffer with it today like we used to in the past. There are some new and exciting, effective techniques that can turn the clock back and rejuvenate your eyesight. Well, joining us today to talk about your eyesight after 50 is Dr. Thomas Findlan of the Pittsburgh Eye Institute. Welcome to the show, Doctor.
Thank you, Carol.
Now, where is the Eye Institute?
The Eye Institute is located at the Jefferson Regional Medical Center, past Century 3 Mall on Route 51.
And all you do is, everything has to do with the eye there.
Everything has to do with the eye, both medical and surgical eye care.
Well, let's talk about the rough times of a 50-year-old. So we're starting to see cataracts. What causes cataracts?
Cataracts is a natural age-related process to one's natural lens that we're born with. And over time, the lens becomes cloudy and hazy, which leads to blurry vision. Some of the symptoms somebody may experience with cataracts are difficulty reading, generalized blurriness, double vision, difficulty appreciating color. So these are all some of the symptoms that are related to cataracts.
I never knew that color was associated with that.
Absolutely.
Yeah, so it's not just color blindness, it's actually... What are some of the things that would cause it? Being out in the sun, is that one of them? I've always heard that.
Sun can certainly lead to progression of cataracts. Proper nutrition can, trauma, things like that can affect cataracts. But mostly it's just a natural age-related process that everybody undergoes.
A genetic link at all? I mean, if your parents had cataracts at a certain age, are you going to see the same?
There are conditions, some systemic diseases that can lead to premature cataracts, so that's certainly possible.
So what happens? I start to see these symptoms, I give you a call, you come out and see, and what happens? I come out and see you, and what happens?
You give us a call, and our staff will schedule in a routine eye exam with you, which includes an assessment of your vision. We will look at your intraocular pressure. Right. We will give you a full dilated eye exam. We will look at your retina, your optic nerve to make sure everything is healthy. We'd also assess the level of your cataracts and whether or not cataract surgery would benefit you.
And at what point do I need the surgery then?
If your activities of daily living, such as driving a car, reading, or your visual acuity in general is affected, we would probably recommend cataract surgery for you at that point in time.
And what does that entail?
Cataract surgery is a very common procedure, probably the most common procedure done in the U.S. today. It's an all outpatient-based surgery. Unfortunately, at the Pittsburgh Eye Institute, we use no stitch, no needle surgery. It takes roughly about 10 to 15 minutes, and the recovery is very fast. We are now offering some new lens technologies. The lens that we implant replaces your natural lens that has affected your vision.
I mean, you're removing the lens that's in the eye and putting in a new one.
We're putting in a new implant lens, that's correct. We have lenses that typically correct your vision for distance. We also have a couple new implant lenses that we're offering. One is the toric lens, which is a lens that corrects for astigmatism. Anybody that has astigmatism preoperatively.
And can you what is astigmatism?
Astigmatism is a curvature to the eye that creates a shape more like a football than a basketball. So it creates some distortions to the vision. Fortunately, it's correctable with glasses. But the idea of cataract surgery is that post-operatively, potentially you may not need glasses for after you heal.
Right.
And anybody with astigmatism, though, will almost guarantee that they're going to need glasses. So by implanting this lens, we're going to give you the best chance possible of not needing glasses.
So so many people have had cataract surgery, and they come out of it saying, I see better than I have in years. So is that usually what the results are?
It is. And the reason is because cataracts typically progress very slowly. So you do not perceive the change in the vision until it's typically pretty bad.
So I mean, the best thing is to get it straight from a patient who has done that. And we have a patient that we are going to speak to now.
Yes, we do. Mr. Leroy Snyder. He has received the new toric premium lens implant that we're offering at the Pittsburgh Eye Institute. Okay,
wonderful. And hi, Leroy. Thanks for joining us with Life Begins at 50. And you had this cataract surgery done?
Yes, I have.
And what was it that you noticed that was wrong with your eyesight?
Well, I had. Nighttime vision was a big thing with me, and especially when it was raining outside. It was very hard for me to focus where I was on the highway.
Right.
So that was a big concern of mine.
So you made the call.
Yes, and I've been going to Dr. Findlan, and the doctor that he took the practice over, he told me about 8 years ago that I would need cataract surgery. So he hit it right on the head, virtually for me. So I made an appointment, and we did it.
Now, how long did it take? I mean, from the time you walked in, the time you walked out?
The longest part was preparing, like the drops in your eyes, and but the surgery itself was really quick and really amazing.
Did you have a astigmatism? Did Leroy have anything that was?
Leroy had a significant amount of astigmatism, and he is probably the most successful patient we've had with the toric lens. He does not need glasses at all for distance post-operatively. With the amount of astigmatism he had, it's just a tremendous result.
So he came out of it with better vision than going in, for sure. And how do you feel now? What was your recovery like?
I feel great. I've worn glasses since I'm in 6th grade, so this is really a treat for me to be without them. But what really impressed me was that the day I come home from the surgery, right after we got home, I had to put some drops in my eyes. So I was laying on the bed, and when I took the plastic lens off, I couldn't believe what I could see, because on my chest of drawers I had some pictures of some kids, and I could see them so plain. So I said to my wife, I says, give me my glasses, I want to check this out. So when I put the glasses on, I had blurred vision. So the vision was excellent. I can't say enough for it.
Amazing. Well, thank you so much, Leroy, for joining us on Life Begins at 50.
Thank you.
So we talked about astigmatism. There are a lot of things that start to happen as the baby boomers are aging towards 50.
Yes.
The cataracts, of course, and if you have an astigmatism, which you can help to cure that.
Right.
I don't want to say cure, but you can,
essentially you are
correct.
curing it. Yes.
Yeah. And what would be another one? Glaucoma.
Glaucoma. As we get older, the very common procedures that we see are glaucoma and macular degeneration. And they're both very scary conditions because they potentially can lead to blindness, and it's important to have routine eye exams. Glaucoma they're both a painless loss of vision. So with glaucoma particularly, one may not realize that they have it.
Right.
So it's very, very important to come in and have routine eye exams to make sure that we can detect that early.
Now, what's your test for glaucoma?
Glaucoma, we measure your intraocular pressure. That's the only modifiable risk factor that we can treat.
Right.
In addition, we do a visual field testing, which is a specialized test that assesses your visual field in a sense, and we do that by shining lights in the periphery of your vision, and a computer generates a printout, and then we interpret that. So with the glaucoma, it's very, very important to have routine eye exams, as I said, and it fortunately is a treatable condition, but we want to catch it early so it does not progress.
Right, and something that, like you said, people don't realize when it's coming on. You have no sense of it. What about macular degeneration?
Macular degeneration affects your central vision. The difference really between glaucoma and macular degeneration is one affects your peripheral vision and one affects your central vision. Your central vision is what you use every day to do your daily tasks, such as you and I looking at each other right now. We're using our central vision. We're very aware of that. So when that is impacted, it makes a significant impact on our life. There's really not a lot you can do for macular degeneration at this point in time. Things that you can do to help to increase your chances of preventing progression of the disease. One is a dietary supplement. We have a specific eye vitamin that has been shown that can reduce the severe form of macular degeneration by 25%. So it's a very important diet modification that we can employ. Another one is smoking cessation. Very, very important. It is known that smoking worsens macular degeneration. Other than that, that's really about all you can do. There are some newer treatments for macular degeneration in terms of the severe form. If there's any bleeding in the back of the eye, there's some newer injections that can be offered to a patient.
Another thing that happens as we age, of course, is we experience several things in the skin around our eyes, and that can either be a cosmetic or for a functional
Correct.
thing, and so that is also something that you do at the Eye Institute.
Yes, we do. And we offer both a functional and cosmetic blepharoplasty. Blepharoplasty is a term for removing excess skin on your upper eyelids. A functional person would be somebody who has excess skin that actually comes down and interferes with vision, affects your visual field or your visual acuity. And we do specialized tests to determine whether or not there's a functional basis for the excess skin. If there is, then we can the patient can undergo a blepharoplasty. And a blepharoplasty is a simple outpatient procedure that it takes roughly about 40 minutes, 45 minutes, and we remove the skin, put in some dissolvable sutures, and allow healing of maybe about a month or so. And afterwards, your eyes have a more youthful, rejuvenative appearance to them. So,
and you have brought a patient that we have a patient we can speak to about that.
Yes, Maureen.
Hi, Maureen. Welcome to Life Begins at 50.
Thank you.
And you had this procedure done.
Yes, I did.
And why? What was happening to you that you made the call?
Well, Carol, functionally, I think I always noticed that there was some loss of my field of vision, especially above and to the side. But more so, I felt that my appearance made me look much older than I was due to the excess eyelid skin.
And so when you talk with Dr. Findlan about this, I mean, like you said, it was functional, but there's also a little bit of cosmetic to it. Is this from the sides and also above? Or
Both.
where do you, okay, so
Both.
it's both from where you take.
Right.
Anything from the bottom or that lifts it?
We can do lower lid blepharoplasty, however,
Yeah.
that's always almost always a cosmetic procedure.
Okay.
So in this case, we only did an upper lid blepharoplasty.
Right. And Maureen, I'm sure that some of your concern too is, how do you heal from this, and and how long does it take? So tell us about your experience. I mean, how long were you in the office for this, and then once you left, how long did it take for the healing process?
Dr. Findlan and his staff at the Eye Institute were very thorough and friendly, and from the time I was evaluated until the time of the surgery, I suppose I waited about a week. The healing process was painless. Within a couple of weeks, you really couldn't tell that I had had any surgery whatsoever. And since then, people remark of how young and rested I look. So I appreciate the aesthetic value of this surgery as well.
Certainly. Well, thank you so much, Maureen, for joining us at Life Begins at 50.
Thank you.
That's a wonderful procedure. And you do, and as you age, it does, you do have that, the skin moves. Gravity takes effect.
Gravity takes hold as we age, absolutely.
Yep.
And it really is a nice rejuvenative procedure that we can offer.
Yeah. Is there a website that folks can go to?
Unfortunately, not yet,
Okay.
but we're in the midst of developing
Right.
one.
Well, thank you so much for being here, Dr. Findlan. Wonderful
Thank you very much.
procedures.
Thank
Great.
you.
Up